Hi, my name is Alexandria Allen, and I'll be presenting Part A of the condition presentation. We'll be talking about the autism spectrum disorder. Autism spectrum disorder, also known as autism, are general terms for a group of complex disorders of brain development. The term spectrum refers to a wide range of symptoms, skills, and levels of disability in functioning that can occur in people with autism spectrum disorder. Autism spectrum disorder vary in degrees and are often characterized by difficulties in social interaction, verbal and nonverbal communication, and repetitive behaviors. Some children and adults with autism spectrum disorders are fully able to perform all activities of daily living, while others require substantial support to perform basic activities. The DSM-5 has included Asperger's syndrome, childhood disintegrative disorder, and pervasive developmental disorders as part of autistic syndrome spectrum disorder. Scientists believe that both genetics and environment likely play a role in autistic spectrum disorder. There is no cure for autism spectrum disorder, but with therapy, behavioral interventions, and medications, symptoms can improve. Very early indicators that require evaluation by an expert would include no babbling or pointing by age 1, no single words by age 16 months, or two-worded phrases by age 2, no response to name, loss of language or social skills that were previously acquired, poor eye contact, excessive lining up of toys or objects, no smiling or social responsiveness. Some later indicators include impaired ability to make friends with peers, impaired ability to initiate or sustain a conversation with others, absence or impairment of imaginative and social play, repetitive or unusual use of language, abnormally intense or focused interests, preoccupation with certain objects or subjects, inflexibility, adherence to specific routines or rituals. Now I'm going to take you to the related video. It is 5 facts about autism. So I will play that for you guys. And I hope you guys enjoy our presentation, and Joe will talk to you about the article.
But in some real important ways, we're still the same, you see. Autism is growing at a faster rate in the United States than any other developmental disability. It's common enough that even Sesame Street has started teaching kids about it. Welcome to Watch Mojo's Top 5 Facts. Today we'll be looking at the spectrum disorder known as autism.
What do I have left? 2 jacks, 1 8, 1 king, 1 6. 2 aces, 1 10, 1 9, 1 5. 1 5. You are beautiful, man.
Number 5. There is gender bias in diagnosing autism. When it comes to studying autism, boys seem to get all the attention. That's because many researchers see autism as a predominantly male disorder and use tools designed to observe male behavior. Boys are diagnosed at an earlier age, and the diagnosis ratio for boys compared to girls is 4 to 1. One study finds that even when a boy and girl's autism symptoms are equally severe, the girl is less likely to be diagnosed. This unfortunately makes it harder for autistic girls to access resources such as early intervention therapy.
This lack of understanding is one of the worst things about being autistic.
Number 4. Horses are good emotional therapy for autism. Working with horses can have therapeutic effects for autistic children. The immersive experience of horseback riding improves focus and motor control, while the powerful bond that develops between horse and rider can draw the child out of isolation, having a strong effect on self-esteem and mood. One theory as to why autistic children bond so well with horses is that both can have a very detail-oriented visual thought process, which is to say they think in pictures. This theory was proposed by none other than Dr. Temple Grandin, who is herself autistic and known for her groundbreaking work with animals. Number 3. No one knows what causes autism.
So the question remains, what does cause autism?
But there may be environmental factors which contribute to it. A study conducted by Arizona State University found the blood of autistic children contained higher levels of toxic metals than that of children who did not have autism. Another study suggests that BPA and plastic could be a link. Having lupus or another autoimmune disorder might slightly increase the chances of giving birth to a child with autism, as does having a serious infection during pregnancy. Researchers at the Cold Harbor Spring Laboratory believe the cause could be genetic mutations which affect as many as 200 genes. However, we do know one thing for sure. Number 2, there is no link between the MMR vaccine and autism. A 2015 study showed that among 95,000 children who were given the measles, mumps, rubella, or MMR vaccine, there was no increased risk in developing autism, even among those who had autistic siblings. Despite the fact that the 1998 report that linked the MMR vaccine with autism has been repeatedly debunked, many parents are still afraid to let their kids receive the shot.
2 years old, 2.5 years old, the child, a beautiful child, went to have the vaccine and came back and a week later got a tremendous fever, got very, very sick, now is autistic.
Between 1999 and 2000, there was a 2% drop in the number of MMR vaccines given to children. Interestingly enough, college-educated mothers are more likely to avoid giving their child the vaccine than mothers with less education. Number 1, autism is costly. And no, most autistic people can't just go to Vegas and count cards. The University of Pennsylvania found that in the US and the UK, the lifetime costs associated with autism spectrum disorder are equivalent to $1.4 million. That number goes up to $2.4 million if they also have an intellectual disability. Most of those costs are attributed to supplemental care and education, and to the lost productivity and wages of parents who look after their autistic children. According to economists from UC Davis, these autism-related expenses will total $268 billion in 2015, and are expected to skyrocket to $461 billion by 2025. So what did we leave out? What do you think is the most interesting thing about ASD?
You know, he has this ability to make everyone around him happy. My family, my friends he meets, the people at the rec center he attends, his workplace, and especially me.
For more neurodiverse top 10s and excellent driver top 5s published every day, be sure to subscribe to WatchMojo.com.
Well, thank you guys, and I hope you enjoyed this presentation, and it will help you guys when you do your clinical work. Have a great day.